Please make sure so as not to interrupt our guest speakers. Second, if you have questions for our speakers, please place those in the chat and we will have a Q&A at the end. Third, this webinar is CE accredited. Woohoo! So please make sure your name is clearly displayed during the webinar so we can record your attendance. If you are attending as a group, please place all names first and last in the group chat so we can record them. This webinar will be recorded. However, CE credit will only be given to those who attended the live session. A recording of this webinar will be uploaded to YouTube once the CE credits have been submitted. All of this information is in the chat box if you need to refresh yourself. And without further ado, let's get started. A little bit of background on today's talk. So the landscape of solid organ transplant pharmacy practice does continue to evolve. The roles and contributions of pharmacists expand beyond traditional direct patient care roles. And we do see lots of non-direct patient care pharmacist roles, such as responsibilities within research, pharmaceutical industry, quality assurance and performance improvement, administrative leadership, and pharmacy benefit management, to name a few. The purpose of this activity is to discuss alternative career paths to allow the transplant pharmacist community to learn more about these unique roles.
The objectives for the talk to keep in mind when getting your CE credit is to describe alternative transplant career options beyond clinical pharmacy, summarize steps to establish oneself in a non-traditional role, and highlight the pros and cons of non-clinical transplant pharmacy roles. We have 4 amazing panelist speakers today, and these are sort of the things they're going to be talking about. They're going to describe their career path that led them to their current unique position, and they're going to talk about what aspects of their transplant pharmacy training and experience has helped them in this role. They'll also address challenges and successes they've had in this role and give us all some advice about, looking inward and expanding ourselves into maybe a more non-traditional role. First up is Elizabeth Cohen. So we'll give the floor to her and let her talk more about her role.
All right. Thank you, Amanda. Thank you, May. And thank you for the invitation to talk today a little bit about my role. So my official title is Manager of Transplant Quality, Compliance, and Outreach, which is kind of a catch-all title. And that's kind of why it's there, but I'll talk a little bit about that in just a moment. And I'm at Yale New Haven Hospital in New Haven, Connecticut. I do a bunch of things in my role, and I'll talk a little bit about that, but I think to just talk about my path that led me to my current position, I was both a PGY1 and PGY2 here at Yale New Haven and practiced as a clinical pharmacist, including being RPD for a number of years, so about 5 years. And in that time, I did a lot of QAPI projects and a lot of things where we wanted to improve our services, both our pharmacy services, but also our transplant services. And I remember very distinctly a couple of years into my career where I was sitting with a multidisciplinary team and we were working on a referral process. And I had my piece as the pharmacist, but I was like, I want to fix this whole referral process. I want to fix it all. And so that's kind of what led me to try to figure out how I could be part of that bigger transplant picture. And so about 5 years into my pharmacist career post-residency, there was a position open called Senior Transplant Data Administrator. It had always been a nurse who had been in that role, often a nurse with an IT background, and was kind of the communicator between, we have Epic, and was that communicator between kind of the Epic team who has no clinical understanding, and then the transplant team who has no IT understanding. And, through my quality projects, I went to the transplant administrator and I said, I'd really be interested in this position. They were having a hard time filling it and, kind of brought forward my idea for what the position could look like and how we could adapt it. And so And something else that was really important to me is I wanted to maintain my clinical competency. So I was able to negotiate to staying on clinical 2 days a month, where I cover the inpatient service for our days off for our pharmacists. And then that really just evolved into then my manager role, where I manage non-clinical staff. So I manage our associate coordinators. Those might be called business associates or other like non-clinical supportive staff for the nurses. And so in my current role, I manage the quality and regulatory team. I have a team of 5 individuals who do data capture, data analysis, auditing, run our QAPI meetings. I also run our transplant operations meetings, and our staff meetings. I manage that non-clinical transplant staff, which is really interesting because, right, that's never a job I've had. It's not a job that I know even all their processes intimately. So that's been really exciting to learn a different process and put my own spin on how we can improve those. And then I also manage our clinic operations. So when we have a new doc comes in, what do our calendars look like? How are we filling them? How are we using our clinic time appropriately? So it's been really learning a lot of new skills in an area that I didn't have before. And to just talk a little bit about the aspects of my training that has really assisted me, I think pharmacy residency training just makes you learn so much. And the research project / quality improvement project from PGY1 and PGY2 really helped me learn different aspects of the hospital, and how to run a good project, how to actually improve a workflow. And so I think that that's been incredibly important. And then I think just working with the transplant pharmacy or the whole transplant team, I don't think I could have the position I had if I didn't have already the relationships that I established as that clinical pharmacist. They knew that I could bring something to the table. And so I think that that was what was really important moving into this particular role. Because I had to sell myself, right, for this position that was not normally a pharmacist, but I had already had the background to back it up. So I think that was really important. So I think that's just a little bit about me and how I got here and what was important for my role.
Thank you, Liz. That was a great example of how standing up for yourself and kind of pitching your own job title can be really successful. So thank you for that. Next, we have Brian Masters. Brian,
Hi, thank you so much for having me. I'd like to first thank you, Amanda and May, and I'd also like to just thank all of you for this opportunity and talking to you today. Before I get into sort of my little segment, I do just need to come forward with a disclaimer that the comments and opinions expressed in this presentation are solely mine and are not necessarily those of my employer, which is Veloxis Pharmaceuticals. So some of you may have had experiences in sort of engaging with medical science liaisons. We're typically tied into either a pharmaceutical company or possibly within the realm of transplant, you've engaged with MSLs who work in the diagnostic field. I sort of simply distilled down here sort of what my role is, and really simplistically, it's to engage with the medical community as a scientific resource and to establish and maintain rapport with key stakeholders, which is a lot of you guys. Transplant pharmacists are very important when it comes to transplant pharmaceuticals, right? Now, my career path into this is not necessarily the normal pathway. Some people go into it a little earlier than I have. I spent 10 years in clinical practice before making this move into pharma. That entire time was all pretty much at the University of Maryland, so in the Mid-Atlantic. However, I am positioned in Salt Lake City, and I made a move across the country and cover the West Coast at my job. That's one of maybe the challenges I'll get into later on, but I would say over those 10 years, one of the things that I realized I was really good at was building relationships within my institution. And, Elizabeth, and I think everybody will probably comment on this, but it's very important at your job as a transplant pharmacist. And I found myself being being able to do this pretty naturally, because there's a lot that needs to occur at these large academic medical centers. And it's not always that the pharmacists maybe have the clout or the power to make movement happen. And so by establishing relationships, building rapport, and sharing with people the needs that you have as a transplant pharmacist, it'll really get you the movement you need. Over my 10 years of time there, I also had the great opportunity to engage with a multitude of students at the School of Pharmacy that we were associated with. We had residents, PGY1s and PGY2s. I actually had the opportunity to be in RPD for some time period, and then moved into a clinical manager role where I was able to oversee a large swath of transplant pharmacists. All of those things were very enjoyable. And as I was thinking about a move across the country, the idea of changing into something that was a little different, maybe into this role as an MSL, but something within the realm of pharma or industry seemed appealing. And so one of the things I did is I began to really work on expanding my network outside of my institution, connecting with those who were in similar roles or had been in those roles to really try to understand what their job is day to day, week to week. And so I kind of used those skills I had that I built in my institution and applied those into really trying to become an MSL before I became one. And so that's my journey in. And I would say really the aspects of pharmacy training or experience that is assisted best in the role is that I think all of you can describe a big component of what you do, whether that be for patients, whether that be for fellow pharmacists, students, across the gamut of your institution, is you do a lot of education. You probably do more education than many of the people you work with in different skill sets. And as an MSL, it's a big component of what you do. You're educating others about either the space of transplant, or it may be related directly to the medication you support, or if you're in diagnostics, the test that you're supporting. And so all of this was really built, I think, on the foundation of the residency skills, working with mentors, and really growing your network. And I continue to try to do that today. So that's a little bit about myself. And again, really, I appreciate all of you for having me here today. Thank you.
Thanks so much, Brian. And that is another, good building block for us as pharmacists to realize that all the colleagues and interactions we're having are really helping us move forward in our career. So next up is Jennifer McDermott. Take it away.
Thank you, May, and thank you, Amanda, for the opportunity to speak here today. I am a pharmacist, and I am working at the U.S. Department of Health and Human Services, the Centers for Medicare and Medicaid Services. Specifically, I work for the Center for Medicare in the Division of Formulary and Benefits Operations. And in terms of disclaimer, the views presented herein are solely mine and do not represent the views of the federal government. I am presenting in a personal capacity. And in terms of, I guess, how I got to this role, my background, I've been a solid organ transplant clinical pharmacy specialist for 18 years prior to transitioning into this government role. It's still hard to say, to not say that I'm a transplant pharmacist. I still own that. So I worked in abdominal transplant first for the first 9 years of my career, and then transitioned into thoracic, working most recently as an adult heart and lung transplant pharmacist, and then started at Center for Medicare in August of 2023. So it's still a new role for me. But I will say that my experience as a transplant pharmacist, especially as a lung transplant pharmacist, and some of the challenges in that space that there are with medication access and utilization management, prior authorizations, a lot of that experience is what made me interested in public policy, and especially, some of the struggles on that side. And so that's really how I ended up developing an interest in working for Center for Medicare and working for the government. In my current role, I do review and analyze drug policy issues and provide technical assistance to interpret, analyze, monitor, and evaluate program guidance about Medicare Part D which I did have been involved through American Society of Transplantation, which as well as with several of our transplant pharmacist colleagues on work with getting prior to this role, working to get compendia up to date with medically accepted indications for solid organ transplant. So again, a lot of that work, really teaming up with all of the public policy work group, and it's really what made me interested in going into this. So a lot of what I'm involved with now also includes utilization management review. And so I know as transplant pharmacists, we struggle a lot with that, with assisting our patients with those prior authorizations. And that's really prepared me to bring that input to Center for Medicare. So with that, I will hand it over back to May to transition to Lonnie.
Jennifer, and I would say many on this webinar today would say once a transplant pharmacist, always a transplant pharmacist. That's a great example of how public policy can really morph into, your career choice or your path, or can really impact patients. So thank you for that. Our final panelist today is Lonnie Smith. And so Lonnie, go ahead and take it away.
Thanks, Amanda. Thanks, like everyone else, to May and Amanda for the opportunity to speak to everyone today. I don't have a disclaimer. I probably should have a disclaimer. Brian was afraid I was going to talk too long. Maybe that's my disclaimer. But my career path and kind of how I got where I'm at, probably a little different than a lot of folks. Obviously, I started out in transplant many, many years ago at this point, but I'll take it back to the mid 2000s there, around 2007. I actually was approached by the CEO of our hospital to take on a management role, in an interim management role for the Department of Transplant. So I spent 7 years, ended up spending 7 years as a manager in the Department of Transplant. That's really where I started on this path of management. Certainly was not my career goal when I started out all those years ago. I love taking care of patients and being kind of in the trenches with folks, but you never know which way life's going to take you. And from that role, I wanted to kind of step away from managing the transplant department. Looked around the institution and kind of like, all right, well, we've done a really good job of filling all of our pharmacy positions, and I don't really have a job for myself. And so we were looking at building up our specialty pharmacy services, and so was asked if it was something I'd like to take on, look at the opportunity in that space. So I've been now in that position since about 18, maybe earlier than that. No, it was like 15. And currently have the pleasure of being, it says on there, manage a team. I feel like it's kind of probably I shouldn't have written that out that way. It's more I'm the guy who is here to support 33 incredible staff members who take care of patients in a variety of different specialty areas. And just get that opportunity. And I think it's an amazing part of my career to see people just move forward and advance practice and pharmacists in a multitude of different areas. And certainly because of my history with transplant and continued work in transplant, and I've been able to continue, that part of my passion I have from all those years ago of starting in transplant 26 years ago now. So still get to see patients on occasion. We're short pharmacists, so we had to make some changes right now, and so kind of moved out of the direct patient care space for the time being until we can get fully staffed up again. But it's a wonderful opportunity to still be able to be in transplant after all these years and to see all these folks do wonderful things. And again, I don't get asked to speak like I used to on these webinars, so I'm very excited to be here to answer questions and give a little bit of a background or advice on kind of what's gotten me to where I'm at today. In terms of what maybe prepared me to do what I'm doing, I think really, everybody on this call, to be in transplant, being a part of a multidisciplinary team, it's relationships. We all have to learn how to work with a lot of different people and different styles. How do you get things done with so many different personalities? And I think transplant pharmacists are in a unique position. You get put in some situations that a lot of our colleagues don't get faced with. And moving into management, you learn, wait a minute, this is a lot like being in the trenches of everyday patient care with some very strong-minded physicians and surgeons, and trying to figure out, again, how do we get what's best for a patient when we've got those personalities, and how do we deal with it. And that's the same kind of thing. And when you get into the management side of the world. So I think those years of just being in the trenches and dealing with those personalities and figuring out how to work with them and make it productive kind of did allow me to develop some skills that have helped me work with now a multitude of different folks. As you can see on the slide, you know, I've got folks from all over the place that I work with, and a lot of strong personalities, a lot of opinionated individuals who you've got to work with and find a way to still be productive in the end with that. And I think, again, what has helped me do that and be successful has been really working in the trenches of solid organ transplant for all these years, and dealing with what everybody here, again, deals with every day. So that's a real quick. I think I kept it short enough so Brian's not going to come after me for talking too much, but look forward to questions coming in the chat, talking a little more.
Thank you so much, Lonnie. That's great. We'll give you plenty more opportunity to talk. So next we have the question and answer segment of this webinar. We have some questions that are pre-populated, but then of course we want to take your questions as well from the audience. I would say across all the speakers, nobody woke up, you know, after graduating pharmacy school and said, I'm going to go work for the government, you know? So it seemed like overall everyone had a clinical role, and then they moved into this sort of atypical role based on an opportunity that presented itself. But what aspects do you miss of your clinical role, if any? I mean, maybe it's the Holy Land that we should all strive to get to. And we'll just go through the speakers in order. So Elizabeth.
All right, I get each question first, and so I have to pre-prepare. So I was fortunate enough to negotiate that I keep 2 clinical days a month, which is just right. It's just right because and I think, you know, others can comment, but I'm good at my job because I actually still know what happens day to day. And so that's kind of the best part about kind of keeping that little aspect. But, you know, it is a lot when I have to cover and then have everything else I need to do too. But I think the thing though I miss about not being in it every day is kind of all the established patient relationships, right? I don't get to have the patient that I see every time they come to clinic. And I'd have to say that might be the thing that I miss the most.
Very well said. I think I'll jump in next if that's okay. So I don't have any role in clinical now anymore with this position. And so I would say, what do I miss the most is the team. You know, I was really lucky to have worked with so many wonderful people over the years at University of Maryland. And like the bond you form with people doing hard, meaningful work is really special. I think it's something all of us can speak to. Additionally, working with students and residents and supporting them through their journey, that was really special to me in my role there. And then finally, I would say the aspect that I think is very different than my current role that I miss probably the most is the relationship and trust that you establish with patients through their sort of transplant journey. And, you know, the impact that those of you listening today have on your patients' lives is truly remarkable and something just not possible directly in my role today. So that I'd say I miss that the most.
Yeah, I guess I will have to echo both of you. I think it's hardest to give up that the patient interaction and the team interactions and what you accomplish in that role. I really do miss I miss those longitudinal relationships that you develop with patients where you see them at their sickest and then getting their transplant, and then after transplant thriving and getting hugs when they come to clinic. And you know, I would say at the best part or the best memories I have are those interactions with patients. And so it was a big struggle for me when I was deciding to go into a non-clinical role. I was really scared to give that up because it had become, like a big part of your identity. You identify as a transplant pharmacist. And so that was really hard for me. And I would say maybe I'm struggling a little bit with it still, but at the same time, I think, you get to a certain point in your career and there's other things that you would like to accomplish as well. So, but yeah, definitely that patient interaction, that's been hard for me to not have.
Yeah, I wish I had something more unique, but I mean, that's obviously one of the hardest things, the direct patient care, although I still get to see patients it's nothing like it is when you're in the trenches every day. I mean, like Elizabeth stated, throughout this transition over all these years now, I've always been able to negotiate a little bit of clinical into what I do. Even when I was managing the Department of Transplant, I was flying out to doing outreach clinics and seeing patients and giving patient presentations and all these things. But I think for me, really, probably a little story real quick, drive it home is in the last year or so, looking at the clinic schedule, I had this patient name. I'm like, who is this? Like, I know this person. What's going on? Is it a pre-clinic? So I'm like, what's happening? And it hit me. I'm like, I know this is. I walked in the patient's room. This young gentleman, about 22 years of age, maybe 23, sitting there with his mom, developmentally delayed, a young man. And I walked in and I said hello, and I looked at his mom and I said, do you happen to remember me? Took a second and she said, oh my God, you're the pharmacist when he was transplanted at 14 months. And so it had been over 20 years, and I had seen that kid and taken care of him after. And that, even today, even sharing the story, gives me goosebumps. And that's the part that's hard, because everybody kind of said it in a different way. It's the relationships that you really get with the patient. And that's what gets you up in the morning, as tough as it can be sometimes. And so I don't get to develop those long-term relationships. I'd taken care of him for several years until we transitioned our pediatric program away from our institution. And but it was kind of fun that she still remembered me grilling her and the family on their medications and a lot of the education things that we did back then. So anyway, that's probably the biggest thing.
It's quite an impression, Lonnie, to live on that long. So that's good patient counseling right there. And it's not surprising that each of you spoke about missing the patients. I think all of us have a clinical background. That's what brought us into where we are today. So for everyone to share that, I think that just is a testament to our deep-rooted clinical training and experience. So thank you for sharing that. Our second question for today is, what is the most difficult part of your job and why? So what struggles have you faced in your role that really kind of stick out to you? Liz?
Yeah, I think the hardest part of my particular role is managing people and like the actual like HR management of people. And being a former RPD, I feel really good about like the mentorship, being compassionate. Some of my former residents are on the call. They may not totally feel that way, but I feel like I got that part down. It's kind of the HR management piece is the hardest part of my job, having those tough conversations and filling holes. I think that's really hard. But it's also allowed me to grow a lot into and to realize what type of manager I want to be, or what type of person, how I want to work with different personalities, etc. So I think that's one of the hardest parts of my job, is just managing people. And in terms of struggles, I think, coming into this particular side, like leaving just the transplant pharmacy realm and seeing the whole picture, it really did take me years to really learn the whole quality regulatory piece of transplant. It takes a long time. And, for me, I'm in a small administrative team. There's only 4 of us in our leadership group. And so really I had to come on board quick. I had to learn it quick, and I'm working with people who've been in transplant years and years. So I think, that was a struggle too, really just dedicating the time to learning the whole part of transplant. I thought I knew, but didn't know as much as I thought I did. So I think that was kind of the biggest struggle.
Very well said. I'll jump in next. Starting with what is the most difficult part of your job and why? I would probably say that the regulatory requirements that are within pharma are very extensive, and sometimes like it's stark contrast to how we practice clinically as transplant pharmacists. I would say often we find ourselves relying upon like a very small amount of data to make the best clinical decision we can at the time. Where within pharma, we can only really make a recommendation to someone in line with what the package labeling of a medication says. And sometimes when I meet people, they're really interested. They know I'm an expert with, with the product that I support. And what is my opinion in XYZ situation? But as it pertains to my company specific product, I can really only make labeled recommendations. And I know that sometimes can like fall flat on people. It's like, oh, I was looking for maybe something else outside of that. And then what struggles have you faced in your role? Well, I would say classically, a lot of MSLs, when they come on, a lot of medical science liaisons, when they come on to a company, they generally practice within the region where they have their clinical practice or where they've been living. And so for me, all of my 10 years of clinical practice before moving over to Veloxis about 3 years ago was in the Mid-Atlantic region of the United States. So I now cover the West Coast and have built up a lot of new relationships. And it has been a challenge, but it's been a really enjoyable challenge, I would say. So that was probably a struggle, but I think I've overcome that now, hopefully.
For me, I would say probably the most difficult part of my job, as it's still a new role for me. I've only been in this role for about 8 months. So it's really just the learning curve. And I think, Liz kind of alluded to that, like you're learning essentially like a new career. And some people that I've worked with have been in the government for years and years. And so I think just being patient with yourself as as you allow yourself to learn new workflows and for me, it's a lot of understanding the relationship between statutes and regulations and policies and how things work and workflows. And so there's really just a lot of new things I'm constantly learning every day, but I will say that's also exciting. I'm never bored now, and there's always something new. In terms of struggles that I've faced, I would say like really that's a struggle in and of itself, right? Just learning a whole new field as a pharmacist. And I would say like also going from being a specialist in one area to applying a lot of those concepts to a lot of different disease states. So despecializing in a way for me has been, an adjustment after, doing transplant for so many years. But again, I am finding it very rewarding and learning a ton.
Yeah, and to play off of those comments, I guess, in terms of most difficult part of your job, I think to Liz's point, the HR component, I definitely, I went in from working with a small team of pharmacy specialists to a team of nearly 70 employees that reported to me in the Department of Transplant. And to say that learning curve was steep and quick is an understatement. And then transitioning over into back the world of pharmacy, but still having a team of 33 individuals. And there's certainly difficulties in that HR. That is not something that I enjoy. I struggled with that for a long time, and I've kind of grasped it and put it into this term for me is that I'm actually happy that I don't enjoy it. because if you do enjoy that HR component, some of the tough things you have to deal with from an HR perspective, my vote would be you might want to look for something else. Because it's a very difficult thing to do personally, and I think that's been very hard. Struggles, the struggle portion of it, I think, is again a couple different things. I went from a perspective of being, that hardcore clinician in the trenches and dealing with physicians and colleagues on a peer level, to when you go into the management role, that's a different relationship, and people look at you differently. And I did not realize that. I was incredibly naive to how that conversation the day before in your position when you're talking about patients and recommendations and how to handle something for a patient changes the next day when you're talking about, okay, this is what services you want. This is how you want something to work, but then I've got to work in the constraints of an organization. And that's something that is also, you're learning on the fly. I don't think that's something that's necessarily taught. And I still struggle with it at times. And I think Jen touched on something that I think is also this, with me having under my purview a multitude of disease states now, and having to get my arms around and understanding rheumatology, GI, IBD, neurology, pulmonary, CF, and all the drugs and the biologics and how it all works and where we're going to use it at and what kind of formulary status it's going to have. How do we get access for our patients? What's the cost? It's just like your head kind of swims at times, and so that's definitely been a struggle. I would prefer, being very honest, to focus on transplant. That's what I really enjoy, but I've got to kind of go outside those boundaries and work on these other things, which can be a little tough. And I'm not getting any younger, so it's getting a little harder to keep up with it all.
All right, thank you. And now that we've convinced everyone on the webinar to never leave their clinical role, maybe we should talk about what the best part of your job is and why that is.
The best part of my job is I get to be a decision maker. And I think going back to the example I gave at the beginning, I have a seat at the table of how we change things and make things better. And that's the absolute best part of my job. And the reason is again, I sat in these meetings and I said, oh, I think we could do it this way, but never thought I could speak up in my clinical transplant pharmacist role. And maybe I could have, but to be able to actually influence it and make changes and update our EMR and collect things better when we have our regulatory survey, and to go back to my clinical pharmacist team and be like, hey, could we do this, this, and this, maybe to improve, our UNOS survey. I think that's the best part of my job is having a seat at the table. And I think that that's really exciting, and it's exciting to be a pharmacist at that table.
Very well said. For me, what is the best part of your job and why? I think I felt in my clinical role, I was often required to focus very much on the day-to-day. There was so much going on, especially in my management role. And I found it very hard at times to really explore what I would essentially describe as like the future of transplant, thinking way ahead. What is it going to look like? And in this position I have, especially being at a small pharmaceutical company, I'm very much focused on what is to come for our company and hopefully play a role in really improving transplant for everyone, and most importantly, our patients. Additionally, I would add that it's very exciting to have this like expanded network of contacts, where in my previous position, I had a great network, but it was all really within my institution or maybe surrounding my institution. And I now have an opportunity to connect with people in almost 40 transplant centers in my region alone. And then when I go to these national conferences, obviously you're meeting with even more people. And I find that to be very enjoyable. You get to learn so much more. I felt sometimes it was hard to break out of, like, I would call it the Maryland box. Like, this is what we do clinically. You read some papers out there, but you really want influence from everybody in the community. And now I find it so exciting to learn more and more how everybody does transplant, how unique and different it is at each institution. I find that to be very stimulating and definitely the best part of my job.
For me, I think the best part of my job thus far has really been working in a team of pharmacists and with managers that have been extremely supportive as I've transitioned from a specialist role into this role. And I think just kind of guiding, I can't speak really enough to like how I really needed that help and direction at times with learning new things. And so working in that environment with a really supportive team has been a game changer for me. And I would say, like, speaking to Liz's point, I think, you know, obviously as clinicians, there's ideas to bring to the table to improve policy. And I think just knowing that I have that ability to contribute to those changes over time. And so that's really exciting.
I think, first of all, Liz going first was great because she really is sparking a lot of thoughts when she's talking, so it's great. But to play off of what she said, I think that, and I didn't realize it, and Liz, maybe you did when you started in your position, but the first time I got asked to come into the CEO's office or to sit on the medical board meeting, and you walk away going, okay, this is a different level of impact you get to the opportunity to be part of. And that is absolutely one of the best parts of the job, because a lot of us, I think, and obviously I'm biased, but I think in transplant pharmacy, you look at the way we approach situations and how ingrained we are into transplant services. We have a lot of ideas, a lot of really good ideas. And how do you get that seat? And I think getting that seat and having the opportunity is absolutely one of the best things. Can be a little maddening at times, but it certainly is a good thing. The other part of it, I'll say for me, at least at this point in my career, and kind of what I enjoy most is seeing all the people around me do the great things they do, right? I've got so many great young pharmacists and wonderful technicians that work with us and taking care of patients and pushing the practice. And very honestly, and people hear me say this at different times, but this is honestly the way I believe things are. And they're so much better than I have ever been as a clinical pharmacist. And I watch them push things and I'm just amazed and wondering, wow, you know, if we had known those things back 25 years ago when I started in clinical practice, wow, what could we have done? But to see where it is today is so much fun. And I do get to see it in my role in areas, right? I mean, we hired the first rheumatology pharmacist at the University of Utah, the first IBD, first CF, CS, first ILD, first MS. And I get to see those pharmacists. It's not me doing it. I'm just, my role is how do I help remove a barrier? If there's something that's in their way, how do I clear the way for them? But it's their success. And for me, that's a lot of what I enjoy at this point in my career, and getting the opportunity to see that. So that's what I would say about that part.
Sounds like there is a little common theme there of enjoying having a seat at the table and that kind of long-term vision of what we are working within. And as far as our systems go, I really like that because I feel like as pharmacists, we're very type A and just want to get in and fix things. So when we can kind of escalate that role, it really is quite an opportunity for us to sing. All right, our final planned question is question number 4. So what was the most surprising aspect of moving into your position, and how have you developed the role that might have been outside the original expectations?
Should we reverse it this time?
Well, you know what? Let's go off script. Lonnie, we're gonna start with you.
Liz, I knew you were going to twist it on me. Like, all right, here we go. Well, I kind of gave a little hint towards it earlier. Most surprising aspect for me in moving into this role was really those relationships with providers, seeing that there's a difference. I had folks that are just, I thought were, when they are, I shouldn't say thought, they're very much dear friends, but the way that you get approached is different. And when it's no longer about that patient in front of you, it's about, well, they want X and you're in a management role, you're in a leadership role, and perhaps you have access to dollars or budgets or, you know, expansion of a service that they're interested in, and saying no to some of those things, and kind of how that did create some tension in some relationships, and then having to figure out how to get back around to a good spot with it. I think that was a surprising aspect that I didn't expect. I just thought, you know, you got all these wonderful relationships you've worked so hard to develop over the years, and there's a level of trust and understanding, and when you get in a different position, it gets twisted a little bit. And the roles, in terms of the different leadership roles I've had at the University of Utah here, and how, you know, maybe I've changed them a little bit outside of original expectations. You know, certainly when I moved into a management role in Department of Transplant, I took on a lot of different things that really weren't part of the role. I had to create, you know, I went into that role really when the conditions of participation first came into effect. And so we really weren't prepared, and it wasn't part of the job description that was asked of me, but we had to create a quality team. We had to create this whole audit process for understanding and meeting all the COPs. And then also I wanted to stay a little bit clinical. And oh, by the way, I also wanted to continue managing a research department, which I'd been doing for years. And so I kept maneuvering things in to have the institutional needs met, but also some of my own personal, professional needs. Because at the end of the day, in any position we all have, right, there's got to be that reason to get up, that reason to come in the morning. And maybe it's not that traditional role that you've been hired into, and how can you make that fit into something for you personally that's going to be professionally fulfilling. And in my current role, again, I negotiated an opportunity to see patients, continue to be in RPD, continue to be in the Department of Transplant, where I sit and work daily is in the Department of Transplant, even though I have purview over all these other areas. And so I kind of just twisted and turned a little bit into these roles, and made it more of what I think meets the needs for the institution, but also does meet the need for me in a professional perspective, and allows me to continue doing what I do, and still be excited about coming in each day to do those things. I still have my toes in research. I still have obviously some teaching and college responsibilities. A lot of you know me from the ACCP work I do in terms of going around doing surveys with ACCP and being involved in residency training, which is a true passion of mine for well over 25 years now. And so getting to do those things and negotiating it out with the institution and the leadership in my own department, and showing that you can do those things, and continue to, again, meet the needs of the role that you're hired into. I think that's the way I've approached it and what's kept me going.
I think for me, the most surprising aspect, I think, in being in this role so far is I never knew that there were so many pharmacists in the government and Department of Health and Human Services. And I think there's a lot of opportunities there that I think when you're in a clinical role, you may not even realize, but there's a ton of opportunities. And, the job descriptions may be more vague, but there's, opportunities in various areas, various components. So that was really surprising to me. And I think I've been able to interact with some of those pharmacists in different parts of Medicare, and been able to collaborate. So that's been really cool. In terms of I guess original expectations, of course, my background is transplant. So when I'm able, I like to be, still work on transplant related efforts. I work on a lot of things that are not just transplant, but I think, management's really supportive. They know that that's my background. And so if there is transplant related work, I get to work on that. So that's been really great.
I'll follow up on that with the opportunity you mentioned, Jennifer. I think that, so what was the most surprising aspect of moving into your position? For me, it was because Veloxis is a very small pharmaceutical company, the medical science liaison, or MSL at Veloxis, we get involved in a number of different internal projects that I would say generally I've heard described in large pharmaceutical companies that entire other departments would handle. And so being involved in that these projects require like a lot of ingenuity and free thinking, and it's really stimulating to be involved in those. And they're obviously transplant concepts, many of which I thought, oh, I already know a lot about this, but as I was able to dig into it deeper and deeper, it really like exposed me to more and more about it. I think that these exposures that really started after the first year of the job, so they gave me a year to get my feet underneath me. They've helped me when I've sort of been trying to look about what's ahead, what opportunity I'm looking to explore. And I believe I have a much stronger idea today, obviously, than when I started about what I want to do when I'm no longer an MSL, when I'm ready to move to something different. And so I think that's what has surprised me the most, how much that is sort of pushed and put forward, at least within my company, is like, okay, what are you going to do next? Where are you moving to? Where within the realm of transplant pharmacy, I had felt somewhat capped out. I was manager of our department, and the next thing I thought I was going to potentially be able to do, maybe something like Liz, like this seems exciting, but it seemed very challenging to be able to achieve something like that at my own institution. What was the most surprising, excuse me, what was something that was outside of the original expectations? Well, when I got the position, I had to convince those that were hiring me that Salt Lake City would be the absolute best location for this job, because originally they wanted to hire somebody who lived in either LA or San Francisco. And so, Lonnie, thanks, for you settling down the roots in Salt Lake, developing this great airport we have here. I was really able to convince a lot of people. And then the relationships you build over the year, some of you may know this, but my boss is actually somebody I tried to hire a long time ago to come work with me. So, those things really were not part of the expectations of the job, but it's something that I made work and the company's made work, and I really love it and enjoy it.
I think for me, the most surprising aspect of my job is I think I know what I'm going to be working on that week, and then Monday rolls around and then my week is totally upended. So and I think, but that's been really exciting. And I think really, part of, because I was this data administrator, I really learned how to abstract data from our electronic medical record and our different tools, and with some stats background and learning how to do that. Now everyone knows, unfortunately, that I can extract data. And so, things come up.
Like, oh, my friend, you almost coming late. Almost. What can I get?
And so things come up where we're talking about implementing a donor center for our OPO, and suddenly I'm on the committee, or HRSA is collecting information from transplant centers and I'm on the call. And so it's been cool things like that, where my involvement in things that I don't expect happens, but it also means really my week is not planned until that that day hits. And so I think that's maybe been the surprising aspect of it, that I thought it would be, I don't want to say more regimented, but maybe more predictable. But it's my job is as unpredictable as clinical pharmacy was. And so I think maybe that's one of the surprising things about my role.
Great, thank you. Okay, now we'll transition into audience questions. We'll see what we have in the chat.
I do have a couple questions that were sent to me. This one is probably going to be specific to Jennifer and Lonnie. How do you remain active in the transplant pharmacist community when your role may have taken a transplant adjacent position? We'll start with Jennifer.
Sure. Yeah. So again, this is a relatively new role for me. So, only having been in it for 8 months, but I would say ways that I've stayed active are organizational involvement as much as I can. And so that's with the American Society of Transplantation and ACCP. And then also being involved with ACCP further. I'm one of the series editors for the SOT SAP. So that's an opportunity to, interact with some of the people on this call and get to collaborate. So I think just trying to maintain some of those like extracurricular activities and you know, like my manager's been supportive of those. And me doing those, and once I get all the necessary approvals and such. So that's been really great.
Yeah, for me, you know, again, luckily I negotiated in time to still see transplant patients and be here in the department and RPD at least for a year or two before I step down. But you know, kind of like what Jen said, is you know, working with organizations with ACCP, AST. I do obviously a lot with ASHP. Was on the commission of credentialing for residency, and then have surveyed probably more than 45 different centers around the country. I've had the joy to go meet with folks and see the future of transplant. So, you know, I've found ways to kind of continue to keep that path. It's extra work. It certainly is outside of the normal 40, but that's okay because, you know, it's going to, again, I'll say it again, in the morning I get up, I'm like, okay, I've got things I really, really enjoy, and then there's things I got to do. And I get to do a little bit of mix. And so it keeps me going each day.
Thank you. We won't let you off the hook for too long, Lonnie, because the next question I think is also maybe geared towards you and Liz, actually. So both of you had spoken a bit earlier about kind of pitching your role and kind of creating your role into what it is now. And so what lessons or advice do you have for pharmacists for kind of doing exactly that and going in and trying to pitch a role that maybe not present in their transplant center?
You want to go
I think
first, Liz?
go ahead, Lonnie.
No. If you want to go first, go ahead. Absolutely.
I think the big thing for me was I recognized that there was a niche, or that there was something missing, and that I pitched the idea that I could fill that role. And I think that was the most important thing for me, was that I could go to leadership and say, I think this is kind of what's missing, and this is why I can fit that picture. And I think that was what was really helpful to develop a position, or to kind of put a non-nurse into a nursing traditional position.
Yeah, I agree 100%. I think for me, I've told people, a lot of different learners and colleagues over the years, I think the one thing that I press is, don't be afraid to fail. Take a chance. I have not been formally trained to do most any job that I've ever taken on. You know, I'm old enough that there was only a few PGY2 transplant residencies in the country at the time. And I'm on the advice of our, you know, wonderful transplant pharmacy leader, Rita Alloway. I actually did not go back to Memphis, Tennessee, and pursue residency with her. I stayed here and kind of created a position in that, and reached out to her quite a bit for guidance along the years. But you know, even as a transplant manager, especially pharmacy manager, taking all these roles on. My parents would probably say that it was a fault in my personality, but I was always willing to go out on the limb and fall, and I have been okay with failure, and picking myself back up and start. And I think that's where it comes. And like Liz said, she saw an opportunity, she saw a gap, and she wasn't afraid to go pitch that and say, you know what, I think I can do this, and then prove that she can do it. And I think that's what, you know, for my advice for anyone coming up. When you're looking for something different, or an opportunity arises that maybe you're like, well, I'm really not qualified for that. Take that out of your mind. Go after it and see what happens. You never know. Odds are, if you can be a transplant pharmacist and be successful in this incredibly stressful, high intensity environment, where you've got to be quick on your feet and really critical thinker, you can go do a lot of different things. You just have to believe in yourself and be willing to take that chance.
All right, I think we're at time. May, did you have any come in, any last minute?
No, I didn't see any more. And that was such a beautiful note to end on.
All right, well, thank you so much to all of our speakers today. We appreciate your time and sharing your experience with us. For those of you that are still logged in, just a reminder that if you were listening in a group, please post all of your names in the chat so that we can appropriately write down for CE purposes. And again, this webinar will be posted to the YouTube channel after the CE credit has been submitted. Thank you all, and I hope you have a wonderful rest of your day.
Thank you.